Medical Monday is brought to you by East Cooper Medical Center.
Here at East Cooper Medical Center, we are joined by Dr. Marc Haro, who's going to be talking to us just about exactly what he does here. And thank you again for so much for joining us today. Just kind of tell us exactly what you specialize in.
Yeah, I specialize in all sorts of injuries in athletic individuals, whether it's knees or shoulders. Those are the two biggest areas that I treat.
Now, I've actually had shoulder injuries before with a dislocated shoulder. So obviously I was one of those kids that, didn't treat it correctly. And now I'm seeing the big long-term effects of it, having a hard time moving it a lot. And especially when it comes to like lifting weights, I'm struggling with that as well. Just kind of tell us the long-term effects of not properly treating it.
Yeah, I mean, depending on the type of injury, there can be some consequences for not treating this. If it's something small such as tendinitis, or inflammation of the shoulder from an overuse type of situation, sometimes it just prolongs the pain. It doesn't necessarily cause anything harmful to occur down the road, but neglecting something such as a rotator cuff tear can have long-term consequences to the point where down the road we may not be able to fix some of the problems that have occurred during that time.
Just kind of tell us the smallest injuries to the larger injuries when it comes to the shoulder and when it comes to the back, those things that you guys have been able to help and either prevent or be able to kind of keep from being such a giant problem.
Yeah, I mean, I kind of break it down in the types of things that we see a little bit by age groups. So kind of the like the 20 and under crowd that have a traumatic injury to the shoulder. Then kind of the 20 to 40-year-old crowd, a little bit more the weekend warrior, and then the 40 and over. Younger kids tend to get more traumatic injuries, more sports injuries, more shoulder dislocations or acute tears. And some of those we need to do something with. Other times we can just rehab through this. When you get to be kind of the 20 to 40-year-old weekend warrior, we still see some of the tendinitis and some of the stiffness issues. Those tend to be more issues that we can a lot of times get people through without having to do surgery, though there are surgical options. When you get a little bit older, we start seeing more degenerative tears like rotator cuff, and sometimes I tell people the clock is ticking on those because more research have shown that sometimes we can't, if we wait too long, we can't go back and fix things. There's always alternatives, but things just don't turn out quite as well.
And it's not just sports, although you guys are connected with Lucy Beckham, so you guys do see a lot of that as well when you have those kids come in and they've got, just those everyday sports injuries, but also it comes with age as well. And the mobility starts to shrink and you guys start to see a lot of those, everyday wear and tear start to become a problem.
Yep, definitely. So, we see tendinitis and, other, overuse injuries, whether it's from sports injuries, like you said, or whether it's just from working out or working in the yard. So, we see athletes, but not only athletes, just people who, have day-to-day pain or with activities are definitely people that we see and treat. And some of those we just get better with physical therapy or certain medications or even injections, but sometimes they do need surgery.
What's some of the things and treatments that you guys recommend and offer?
Yeah, so I think the biggest thing is, keeping people's, motion and strength as good as we possibly can. And if needed, making sure we get them to see physical therapy or making sure whatever activity they're doing well, they're doing it correctly, and working with athletic trainers or physical therapists in the region so they have proper mechanics and keep themselves from getting injured.
And just kind of tell us, what an unsolved or I guess untreated alignment with your shoulders and your back, what that can actually bring down the road for somebody.
Yeah, so what we tend to see is, little tears or little injuries that eventually progress onto big tears and then loss of function. So people a lot of times will have a little tendinitis that can lead to, small, amounts of inflammation or tearing of the labrum in the shoulder, some cartilage, or small tears in the rotator cuff that don't really limit people. But if untreated or if people continue to do the things that they're doing and this progresses, sometimes it ends up being a full tear and people lose significant amounts of function, and that can be life-altering.
Is there anything that we can do at home or anything that we can do to kind of prevent ourselves from just, this happening?
Yeah, I mean, it's hard. Some of this is just wear and tear and some of it's bad luck, but staying flexible, staying strong, listening to your body, making sure that you're not, pushing through pain always, and using correct mechanics for the activities that you're doing is one of the best things you can do to keep things essentially going and keep you from getting in trouble.
Perfect. And just kind of tell us, what's the next step for the shoulder pain and things that we just can't fix, that we know we have to come to you guys. How do we go ahead and set up an appointment, and what can we expect out of that appointment?
Yeah, I mean, so if things are not getting better on their own and you're dealing with issues that keeping you up at night, definitely reach out to us at the Sports Medicine Specialist of Charleston. Either on our website or give us a call. We're always happy to get people in. We usually do a very good thorough examination and get diagnostic imaging if appropriate and come up with a game plan to get people back in, the activities that they enjoy.
Perfect. Thank you so much for your time. And if you have any more questions, you can go to eastcoopermedctr.com.